I'm going to answer a few things here with regards to Medicare for all, because I think people need to get the right kind of answer. What irks me most of all is that everybody here that is speaking out against Medicare for all was coerced, was convinced into denying arithmetic, was convinced into denying math. Rudnin, I know you're bringing up a lot of studies that prove that Medicare for all would save a lot of money, et cetera, et cetera, et cetera. But the case is a lot more simple than that, right? The first concept that I want to get out of people's minds is that somehow private insurance give people choices. That is false. So it is false that private insurance give the customer a choice. You get the choice of picking which private insurance you want. And then after you've made the choice of which private insurance you want, they decide what care you are going to get. It is tantamount to saying, which slave master do I want? Which master do I want to be as a slave? Private insurance does not give choice. They tell you what doctor you can see, what drugs you can use. So I want to dispel that particular thought process first. Private insurance does not give you choice. It gives you choice of which master. It gives you choices. Which company would you prefer to screw you? That's number one. Number two, for those who say that Medicare for all is an authoritarian concept, it couldn't be the furthest thing from the truth, because standard Medicare, not Medicare Advantage. Medicare Advantage is nothing more than private insurance in sheep's clothing. And let me back up a second. Private insurance in the past, in the 40s, in the 50s, they refused to cover old people, or if they covered old people, they charged them 3 times the price. Now, private companies have coerced our government to pay them more per policy to insure older folk. And what that simply means is that we are subsidizing rich fat cats, executives and shareholders of these private insurance companies. Number 3, the idea that somebody would say, if we got Medicare for all, it would bankrupt us. That is tantamount to saying that we don't have enough resources to cover all Americans' health care. And as such, we relegate a few of our people to die. Because if we are saying we cannot create an environment where everybody has health care, it means we're saying only those who can afford health care will get health care, and thus we relegate the others to die. Number 3. Now let's go to number 4. Number 4, to accept that private insurance, we're talking private insurance now, we have to believe that private insurance can somehow be less expensive than public insurance is asking you to not think critically. It is asking you to forget about arithmetic. Whenever you have several insurance companies, every insurance company must have its own CEO, CFO, its own databases, its own buildings, its own infrastructure, shareholder dividends, executive pays and bonuses. The people who sell the product gets a whole big piece of the action. The amount of overhead to pay a bill under private insurance is humongous. Basic arithmetic says, if you take out the middleman, that private insurance company, and use all those benefits, that even if you had 10% waste in the system, which would be billions upon billions of dollars, it would still be less expensive than private insurance. These are mathematical facts. These things are not up for debate. These are simple mathematical facts. Now, Jack Smith or Smith said, made a comment that then should give people pause. Well, if we decide to have Medicare for all, we would get less services. Again, you're defying math. First of all, you assume that services come at the volition of private companies. That is demonstrably false. Most drugs, most technologies, including this new drug that's about to make the drug companies a bunch of money, the new diet drug pill that seems to be successful in having people lose weight. All of these drugs had their genesis at universities or provided by grants. All of them. I didn't say some. I said all of them. Drug companies, corporations, they do not take risks. Risks are taken at universities where we, the people, the government pay. The corporations take what's called calculated risks. What are calculated risks? After we have a good feeling that this stuff may be successful, we then go ahead and invest into bringing it to market, but it gets worse. Now, there are times when drugs that seem to be successful will not turn out to be successful. That's true. However, let's be clear. Even when a company loses money for a drug that was not successful, they still don't lose the money that they use to develop that drug. Why? Because after they have failed with a particular drug and let's say invested a few $1 billion in it, they recover every penny of those billions of dollars in the form of tax write-offs for the losses. We have been hoodwinked into believing. Look, I just gave you a cogent 100% fact-based statement. We will still have people that decide to deny math. We will still have people that decide to deny the reality that if you have to pay a lot of other people to administer this thing, it's going to cost more. If you have many insurance companies, that doctor's office is a lot more expensive. You pay more to a doctor because that doctor has to hire more people who find which plan, which insurance they can bill, etc. So my friends, all around, what those are denying Medicare for all, universal health care, they're simply wrong. Simply wrong. Everything that I've just stated is corroborated by facts. You can look it up. I don't ask you not to look it up. I want you to look it up. Because those of you who deny these statements that I've just made are the ones who, in fact, are carrying water for those who are screwing you, your family, your relatives. Now, John Smith says that I am wrong. Give me a call at 281-823-7747, and in your own words, detail specifically, factually, mathematically, why it is that you think I'm wrong. So please give me a call. 281-823-7747. You think I'm wrong. Make your point. Make your case. The thing about it is, I am absolutely sure that I'm right. You know why? Because numbers don't lie. Numbers don't lie. Corporations lie. Corporations fool because they simply care about their bottom line. Daniel Ledo says, notice Egberto never talks about the billions the pharmaceutical companies make with the vax. Never hear. No, I do talk about that. It's a ripoff. I spoke about what they're doing with the vaccines. Now, I do believe it's a ripoff. Daniel Ledo, that's not true. The pharmaceutical companies are thugs. They are thugs, including the ones who make the vaccines that all of us depend on. They are thugs. Anything else you'd like to know about that, Mr. Ledo? Anything else you'd like to know? The biggest crooks in this country are heads of corporations. The petty thief that goes into a 7-Eleven and steals something, that's not a problem. The petty thief that picks one person's pocket, it's bad, but it only affects one person. The health care companies, the pharmaceutical companies, They are massive thugs. They are massive thieves. You know, if we had Medicare for all, we're, as my friend in Canada that I'll meet again at Netroots here, you have a card. You just have that card and go in for medical care. My friend in Canada, when he came out, he said, you know what's the interesting thing, Egberto? When we have to see a doctor, the last thing on our minds are, what is it going to cost? We go see our primary care guy. Our primary care is like that dispatcher, and that dispatcher sends us where we need to get, whether it's be a specialist or otherwise. John Carter says, if we had Medicare for all, we wouldn't need all these schemes to fill the holes. Exactly. Michael Rudden says, Egberto, our broken private healthcare system kills in excess of 70 million Americans per year, mostly due to the denial of coverage, prescription price gouging, and underinsurance. We can do better. We have the money to do better. We have the money to do better. The reason why we don't do it is because we have, first of all, gullible folks that choose not to understand math. They choose not to understand the concept of being taken advantage of. And when they get taken advantage of, they just said, please do it again. It's that simple. I made the cogent argument, a fact-based cogent argument from a math standpoint. It is impossible for private healthcare that has profit, shareholder value, and duplicate services to be less expensive than a single payer system. It's mathematically impossible. But, you know, some folks will choose not to accept that reality. It's a mathematical impossibility. We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.